Welcome to Buzz TV's Health segment. I'm your host, Joe Snowberger. Today we have a unique presentation for you because typically in the health segment I bring you doctors and dentists and different medical providing services for you to know where to get your health care. Today I want to introduce you to the Institute for Healthcare Excellence. They serve the medical industry to keep their quality and their excellence up. I want to introduce you to the founder, Dr. Bill Maples, and the Chief Experience Officer, Jennifer Krippner. Welcome to Buzz TV.
Thank you.
You have a unique institute. Let's just go ahead and dive in. Tell me what your institute does.
Yeah, so the Institute was really founded to really help organizations, physicians, nurses, all of the frontline caregivers really develop the skills to connect with their patients, with their families, and with each other to really form a cohesive team that can deliver the very best care in the most efficient way, in the safest way, in a way that really addresses the needs of patients and families and needs that they've been asking for the last 25 years. But to be frankly honest with you, we've been had trouble delivering. So we focused our efforts to really first figure out what that was, and second, how are we going to actually help our team get there?
So you're a communication enhancement organization in a roundabout way. You know, in the old days, Mary Poppins told me it takes a spoonful of sugar to get the medicine down. What I'm hearing is, if you have a great relationship and you can connect with those people, that's the spoonful of sugar at enhancing them doing what they need to do medically.
It exactly is what you nicely phrased. It is all about communication, and no matter how you slice it, no matter how you really look to make the interventions that are necessary to create that cohesive team, that relationship that you're talking about, it all boils back to communication. And it seems simple, but it's actually hard work. And we help make that work doable, achievable, diffusable, and fun for the organization to walk through.
Communication at an impactful level is very, very difficult. A lot of people, typically, we just ask what you do, and we don't. And I think the communication equation is the sum of what you do with the impact of what you do, and that helps open up the door to figure out how you're going to relate to me. And if you can accomplish that, that's terrific. Would you talk about some of the other services that you bring to your clients?
Sure. One of the major challenges that American healthcare is facing right now is this issue of our caregivers, our physicians, our nurses, our team is getting burned out. One of the major contributing factors to burnout, and there are several, there are system issues and there are individual issues, but one of the things that's actually driving that is the lack of our team and our caregivers to truly connect with their patients. There are things that actually pull us away. The electronic medical record, all of the technology will pull us away. There are other things that pull us away. And we've actually lost that connection. And if we can restore that, it actually is one of the ways that we can fill the tanks back up, the hearts and souls of our providers. So how do we really connect not only to give the best care, but how do we do that to actually help us restore our energy as we're there taking care of patients in their most vulnerable time, and a time that we just have to be there and connect in that meaningful way.
So I've got to practice, I work hard, my team's effective, we do a good job, but I'm missing that, get that boost back up to really have that attitude and that experience within my practice and I can see it impacting the delivery. That's the kind of folks that you want knocking on the Institute for Healthcare Excellence door to engage you to help them excel.
That is very true. I also think that it's not only wanting your patients and families to have a great experience. That's the result and the outcome of the work. We really want our physicians and our staff also to have joy and experience resiliency in the work that they do and really return them to the purpose. So it's really a twofold approach.
Sounds like the ideal workplace to me.
Yeah.
So,
and one other thought on that, Joe, when you said when you have a team that's really working effectively and all of those cylinders, but you're not connecting, there's sort of an oxymoron there. You can think you have that team,
Right.
but you actually, when you lose that connection between the patient and the team, and even between the team members, that team begins to not function so well.
I totally understand. I'm a student of team development and connecting and sharing of value. I'm really excited about introducing you folks. And so they would find you at the Institute for Healthcare Excellence. I'm assuming that they can Google that, and they're certainly going to share this video with their doctor and with their colleagues in the medical field. Again, that's the Institute for Healthcare Excellence. They're located right here in Ponte Vedra, Florida. Dr. Maples and Jennifer, thanks for being on The Buzz. I hope you share this on Facebook and social media. We'll see you next time on The Buzz Health Segment.